make sure that in this era in which you are examining your breast, what can you basically do? In breast examination, it is so easy, and so I entreat every individual that we should take advantage of our media space. We should watch our televisions and look at health personnel who come on our TVs to educate us or show us how to examine our breast. And we should do this 5 to 7 days after our menstrual period. That is the ideal time that is being given to examine your breast. So 5 to 7 days after your period. Then any other day, if you are not in your menstrual, you are not menstruating. So these are basically the times that you can check your breast. So all that we have to say about every cancer, which includes breast cancer, is that early detection saves life. Do not listen to the myth and the misconceptions that surround us. For every disease conditions, there are things that people will say. People who do not even have academic knowledge or have nothing to anything to back their saying would even talk. But what I would want to entreat all of us is that when you are going through certain things or you have certain changes to your body, especially with breast cancer, walk to any health facility. All the signs and symptoms that you might hear on our TVs and our radios are not necessarily saying that you are having breast cancer until you come to the health facility for you to be examined, for scans to be carried out, for other diagnostic tests to be carried out. We wouldn't tell. You cannot tell if you have breast cancer or not. So when you see any changes around your breast, now what are some of the changes that you can see around your breast? What are some of the signs and symptoms that you can see around your breast? So we have inflammation of the breast. Your breast becomes very reddish, as if someone has poured hot water on your breast. Some people have discharges from their nipple, which could be bloody discharge, yellowish discharge, greenish discharge. Any discharge that comes out from your breast, if you are not breastfeeding and you have any discharge coming out from your breast, kindly walk to any health facility and have your breast examined. Some people's breast also looks like an orange. The skin of an orange. Dimpling of the breast. So when you see that your breast is becoming like an orange, the skin of an orange, you can also come to the health facility for us to examine your breast. And retracted nipple. So some people have their nipples pulling inwards. Some people naturally have retracted nipple, but when they touch it, at least it comes out. But in this case, even when it is being pulled out, it doesn't. So retracted nipple is also one sign. And one of the cardinal signs of breast cancer is a lump in the breast. This is the cardinal sign of breast cancer. But in most cases, this lump in the breast becomes painless to some people, and some people also experience pain with the lump. The lump might not necessarily start from your breast. Some people's lump starts from their armpits, around the clavicle, around the collarbone. So you must know your breast in the first place. Know how your breast looks like, so that when there's any change in the size, in the shape, in the skin color, you can detect it and walk to any nearby facility for you to have your breast examined. Don't wait for the month of October to always come for you to examine your breast. Make sure that you examine your breasts every time in every month, so that when there's any abnormality, you can detect it or walk into the nearest health facility for you to be cared for. Thank you very much.